Hi guys, my name's Tom. I'm the clinical site manager.
Hi Tom, this is Dr. Tom, and Dr. Tom is running the clinic. How are you?
Good, thank you.
It's lovely. We thought
Day,
we thought we might go for a walk with you. What would you like to tell us about this amazing?
Great. So this is the old dental clinic, and effectively it's been repurposed for the CBAC testing for the eastern suburbs, which is a great location to have it, and we're so lucky to have it. It's an amazing place. I'd love to show you around.
Oh, thank you very much. We were sort of really worried about, being contagious and whatever, so we thought we might ask you a little bit about safety. So shall I follow you and you can tell us what you've done?
Let's go on through.
I love your fence. That's very, very safe.
Would you like to start with here?
Yes.
So effectively, when the patients arrive, they'll be speaking to the front desk. So here's Christy. Hi Christy, how's it going?
Hey, thanks. How are you?
Good, thank you. Just showing everyone how it all works.
Hi Chrissy, lovely to see you.
And effectively, Christy's going to be checking the information with the patients and then popping some information and a mask through this little slot.
Wow.
And then the patient can then effectively move their way through into the clinical area.
Oh great, we'll come with you. So, look at this lovely fence, whānau, very, very safe, so no ākonga can get into the clinic. There's our very lovely Deputy Principal, Rebecca. Hi Rebecca, it's lovely to see you. Thank you for your hard work. So we're following the fence, so actually patients can't be near ākonga at all. They're completely divided by this very nice, safe fence.
Okay, so the patients will normally come through sides, following the green line.
Oh wow.
Mark
Yep.
the steps here.
Yes. Also, we won't be able to use our courts for a wee while, but we can use the far gate perhaps, Dr. Tom.
I think that'd be a good idea. This is all being linked up and secured, so there's no way into the site apart from that entrance at the front area.
It certainly keeps people safe. So I'm following the green line.
Would you like to see inside?
I would love to see inside, thank you.
Okay, come on through. So we've got no patients here at the moment.
Excellent. Oh, isn't it flash?
Come on down. Come on
Thank
down.
you.
So
I'm following the green line, whānau, and look, there's arrows to show me where to go.
We have 4 rooms here. 4, 3,
Wow.
2, 1.
Oh, yes. So what happens when I'm a patient, Dr. Tom,
Sure.
once I get here?
So you'll be greeted by a nurse
Yeah.
at the front door.
Yes.
And the nurse will bring you through to a room that's ready to accept the patient.
Uh-huh.
And I'll step on through. The doctor's usually wearing full gear. We're talking about goggles,
Yeah.
face masks, and a big yellow gown and gloves.
Yes.
The patient is effectively going to come into the room, be greeted by the doctor, and then we're going to do a hand hygiene rub down.
Ah.
So I think
Would you like to show us that?
Of
Because I think
course.
there's a real technique to it, isn't
If
it?
you want to come this way, so
Yes.
what we basically do is we go through the technique of washing the hands,
Ah, yes.
and effectively that's going to be hands side to side,
Perfect.
back like that,
Yes.
and the other side,
Wow.
linking the fingers,
Yes.
linking the fingers.
Gosh, it doesn't look like that at the supermarket, Dr. Tom.
Ooh. We try and add value to the patient's movement through the site, and if we can give the best hand hygiene technique that there is, then this will not only help COVID-19 but fight COVID-20, 21, all the next kind of
Excellent.
bird and swine flus that could come on through.
Great.
So once we've done a very good hand hygiene under the rings as well,
Ah, good
then
thinking.
we effectively have an excellent hand hygiene event.
Great.
And then the patient will be moving through to the seat here,
Yes.
and then the doctor will ask a number of questions about travel and contacts and symptoms,
Uh-huh.
and then the doctor will listen to the chest, and then do the temperature, do heart rate, do saturations with all the equipment that we have on the table,
Oh, wow.
and then after that they do the swab.
Uh-huh. Oh, so tell us about the swab, because some people might be a bit apprehensive about
Sure.
a swab.
So the swab effectively will be a very, very tiny Q-tip. I'm sure I can probably find one that hasn't been used, and the Q-tip goes into the back of the nose for a few seconds and effectively manages to get effectively a bit of snot, and that can be then tested for viral bugs. So
And is it very painful?
Not at all, no.
Great.
My recommendation is just to put yourself into a nice calm state. It
Yes.
lasts 10 seconds, and it's over and done with. Better that than an injection, that's what I say.
Definitely.
And effectively, it's a really good way of getting the information from the patient.
And how do you make sure that there's no risk of contamination when so many people are coming through?
So after the patient's left,
Yep.
we do a second hand hygiene event with them.
Yes.
And the patient's gone out the door and they go back to their car. What the doctor does next actually takes up the most amount of time. He or she will be wiping down each surface, this surface here, and the chair, and the alcohol dispenser,
Perfect.
and the equipment with not one, not two, but 3
Yes.
wipes. There is bleach, detergent,
Wow.
and alcohol gel.
Excellent.
And effectively, every single thing that the patient or the doctor has touched is washed by 3 different chemicals to make sure that the bugs are all killed.
Great. So when I'm the next patient, there's no risk of infection.
Correct.
Brilliant.
Correct. The next patient effectively is going to be fresh into the
That
into
is
the room.
fantastic.
So we try and reduce as much as possible the risk of the next patient and the staff that work here getting any bugs.
Absolutely.
And
and so you think you're all safe? Is this a good place to be?
Well, good question. I think this is one of the safest places to be in the
Excellent.
whole of the country, probably the whole of Canterbury. Not only are we using the best equipment we have available, but we're using the best and most recommended techniques to make sure that there's no single particle of coronavirus left. And actually, it's a lot of the staff who work here, including myself, feel that this is one of the best places to be, probably safer than other locations that we've worked at.
That is fantastic. So really there's no risk for our students as long as they maintain the protocols and walk on the other side of the fence and stay with the adults.
Yes, that's right. And if they keep to the strategies that we've put in place, then it should be absolutely fine, and we'll sort this coronavirus out once.
Excellent. So I've had my test. What happens to me next?
So once you've come out of here,
Yes.
and the doctor does the alcohol wipe event.
And do
with
I
you,
have to do that as well?
Everyone has to do that
Everyone
on the way
has to
in
do it.
and out of the room.
Excellent.
So it's twice for each
person. Great.
And then we'll be going all the way out the.
Oh, and I'm following my green line again. Goodness me. Isn't this just so beautiful? I didn't realise we had such a fabulous facility. And out we go, and following our green line and Dr. Tom. Oh, it's a lovely sunny afternoon. And so I've had my swab, and now I'm just walking back and I go and find my car.
Straight on back to the car through that little entrance.
Oh, well, I want to thank you so much for your time this afternoon, and I think I feel much more confident that we don't have anything to worry about at all.